Welcome to the deep dive. This is where we take, well, a whole stack of sources, articles, research papers, and really boil them down into the key things you need to know. Today, we're diving headfirst into something that might sound pretty niche at first glance, but trust me, it's got these profound real-world implications, especially for global food production. We're talking about porcine coccidiosis. Specifically, this tiny, but honestly incredibly mighty parasite called Isospora suis. It's a major headache in modern pig farming, particularly for those really vulnerable newborn piglets. Our mission today, to unpack all the tricky details of this disease. We'll cover its really sneaky life cycle, its big economic impact, which is often hidden, basically giving you a shortcut to being properly informed.
And you've really hit the nail on the head there. Its significance is vastly underestimated a lot of the time, because while Isospora suis might not often kill piglets directly, the widespread sickness it causes, the morbidity, well, that translates into pretty substantial hidden losses for the global swine industry. It's actually a fascinating example of how something completely microscopic can have such a massive ripple effect, on something as basic as our food supply.
Okay, let's unpack this for you. What exactly is porcine coccidiosis? So fundamentally, it's an enteric disease. That means it affects the intestines, right? And it's caused by these protozoan parasites. The main troublemaker, the really problematic one in suckling piglets, is Isospora suis, though you might sometimes hear it called Isospora suis. Same thing, basically.
Yeah, and it's important to get this. While other sort of similar parasites can infect pigs, things like Eimeria species, Isusis, it's just overwhelmingly the dominant one, and the most pathogenic, the one causing the most trouble, in newborns. It's what we call an obligate intracellular parasite.
Okay, obligate intracellular. What does that mean in simple terms?
It means it has to live and replicate inside the host cells. It can't just hang out in the gut. Specifically, it targets the cells lining the small intestine, the enterocytes. And this internal multiplication, this living inside the cells, that's absolutely fundamental to understanding how it causes so much damage.
Right. So when these tiny invaders get inside those cells and start multiplying, what's the immediate effect? What does it look like for the piglets? What are the key clinical signs we should be looking out for? And is there anything sort of counterintuitive about how it affects them, like mortality versus just getting sick?
Well, the main signs you'll typically see are diarrhea, but it's non-hemorrhagic, so no blood, usually, along with that dehydration and a really noticeable reduction in their weight gain. They just don't thrive. But what often surprises people, is that direct mortality from uncomplicated coccidiosis is usually quite low. The real issue, and where those sort of hidden losses really pile up, is the incredibly high morbidity.
Morbidity.
Right. Exactly. So while most piglets might not die directly from it, a huge percentage get sick, they perform poorly, they don't grow well.
And it's that widespread sickness that really hits the economics. We're talking serious losses from poor piglet performance, right? And then being more vulnerable to other infections. Plus, uneven weights at weaning.
Precisely. And another big problem is that this disease is frequently underdiagnosed or even misdiagnosed.
Why is that?
Well, because the signs are pretty nonspecific. That diarrhea could easily be confused with other common causes in young piglets, things like bacterial infections, say colobacillosis, or maybe a virus like rotavirus.
Oh, okay.
So a really critical clue, but one that's often discovered a bit too late, is when the piglets just don't respond to standard antibiotic treatments.
Because antibiotics don't work on parasites.
Exactly. It's a parasite, not bacteria. That lack of response is a big red flag.
Okay, this is fascinating. To really get a grip on this, we need to dive into its life cycle, which you described as incredibly clever and insidious. Can you walk us through that journey from the environment through the piglet and back out again?
Absolutely. It all kicks off with the oocyst. Think of that as the environmentally resistant stage, like a tiny, tough egg that gets shed in the piglet's feces. It's roughly spherical, about 20 micrometers across, so tiny, with this smooth, protective wall. Now, when a piglet swallows one of these oocysts, but it has to be a sporulated one.
Sporulated, meaning what exactly?
Meaning it's matured in the environment, it's activated and ready to infect. Once that happens, the internal part of the life cycle, the endogenous cycle, begins inside the piglet.
Okay, so it's inside the piglet now. What happens next? Where does it go?
Right, so inside the small intestine, the oocyst breaks open and releases 8 tiny infectious units. We call them sporozoites. These little guys quickly invade those gut lining cells, the enterocytes, mainly in the jejunum and ileum sections of the small intestine. And what follows is, well, frankly, an explosive internal multiplication. The parasite goes through multiple rounds of asexual reproduction inside these cells. Imagine one parasite turning into thousands very quickly.
Wow.
Yeah, each new generation bursts out of a host cell, destroying it in the process, and then invades new cells. This constant cycle of invasion, multiplication, and destruction is what causes all that damage to the gut lining.
That sounds incredibly destructive.
It is. After these asexual stages, the parasites then develop into sexual stages, male and female, which then fertilize each other, form a zygote, and this matures into a new unsporulated oocyst. And these unsporulated oocysts are then shed back into the environment in the piglet's feces. This whole process, from infection to shedding, takes about 5 to 6 days. That's the pre-patent period.
Okay, 5 to 6 days. And that brings us to the external part, the environmental cycle. You said those shed oocysts are unsporulated, so they're not immediately infectious.
Correct. They need to mature or sporulate in the environment first. And here's where the parasite's, well, ingenious adaptation really comes into play. It almost creates its own perfect storm. See, sporulation needs specific conditions. The right temperature, enough moisture, and oxygen.
And the optimal temperature is?
It's between 30 and 37 degrees Celsius, which is precisely the temperature range farmers maintain in the creep areas of farrowing crates to keep newborn piglets warm.
No way. So the system designed to help the piglets actually helps the parasite.
Exactly. Modern production systems designed for piglet comfort and survival inadvertently create the absolute ideal breeding ground for Isospora suis. And under these perfect, warm, moist conditions, sporulation can happen incredibly fast, sometimes in as little as 12 to 16 hours.
That's incredibly fast. And once they're sporulated, these oocysts are tough customers, right?
Extremely resilient. That protective wall makes them resistant to drying out, to temperature swings, and crucially, to most common chemical disinfectants used on farms.
So they could just hang around for ages.
They can survive for many months in the environment, yes, waiting for the next host. And this resilience, combined with that super fast sporulation time in the farrowing crate, creates what we call a truly self-perpetuating cycle in farrowing houses.
Self-perpetuating. How does that work exactly?
Okay, picture this. A piglet gets infected maybe right after birth, perhaps from some leftover oocysts in the pen. By day 5 or 6, it starts shedding its own oocysts, millions of them. In that warm, moist, farrowing crate, those newly shed oocysts become infectious in just, say, 12 hours. This creates a cascade. The littermates are suddenly exposed to massive infectious doses by around day 7, so those first few infected piglets basically act as oocyst amplifiers, completely contaminating their shared space for their brothers and sisters.
Ah, that explains why you might see clinical signs appear in waves within a single litter.
Exactly, and it underlines a crucial point. The primary reservoir, the main source of infection, isn't the mother sow, it's the farrowing pen environment itself.
That's a huge takeaway, the environment, not the sow. Now, you mentioned briefly an unresolved research question about extraintestinal stages. What's that about?
Yeah, it's an interesting point. Some related parasites in the Isospora genus can form dormant stages, like little cysts in tissues outside the intestine. For Isus, there's some indirect evidence this might happen, but it hasn't been definitively proven. So we don't know for sure if it can hide out elsewhere in the piglet's body. It's definitely an area for future research.
Okay, so we've traced the parasite's sneaky journey. But how widespread is this problem globally? What does the epidemiology look like on farms?
Oh, it's everywhere, globally distributed, and the prevalence rates are really high. We often see like 75 to 90% of farms testing positive at some point. And on those positive farms, maybe 40 to 50% of the litters will be affected.
That's huge. And is there a typical time when it peaks?
Yes, peak prevalence, when you see the most infection and the highest oocyst shedding, is usually in the 2nd and 3rd week of a piglet's life.
Right, in that critical early growth period.
Yeah.
Now, we talked about the temperature and the farrowing crate being perfect. Are there other aspects of modern farrowing setups that maybe unintentionally make them such good incubators for this?
Yeah, absolutely. Beyond just the heat lamps providing that ideal 37 degrees C, you've got moisture from feces and maybe spilled water, which is also needed for sporulation.
Yeah.
And another thing is the oocyst wall itself. It's actually quite sticky.
Sticky.
Yeah, which means they cling really tenaciously to surfaces, floors, feeders, partitions. This makes them incredibly difficult to remove completely, even with pretty rigorous cleaning protocols.
Wow. Okay, so that brings us to a really critical epidemiological point you touched on earlier.
Yeah.
Who is the main source of contamination? Is it the sow or is it the piglets themselves? This next finding you said is a real game changer in how people need to think about controlling this.
Right.
Most people assume the mother sow is the source, right? But the research shows something else.
Absolutely. It's probably one of the most counterintuitive findings for many producers, but the evidence is clear. Sows are largely off the hook. They rarely shed Isospora during the lactation period and seem to play a minimal, almost negligible direct role in transmitting the infection to their own litter.
So where do the piglets pick it up from then initially?
The key understanding for producers is that this is fundamentally a facility-borne disease. It's overwhelmingly horizontal transmission. Piglet sheds oocysts into the environment. Those oocysts sporulate rapidly, and then other piglets ingest them from that contaminated environment. It's piglet to environment to piglet. And remember, those first few infected piglets, they shed vast quantities of new oocysts, up to 100,000 per gram of feces as possible,
Incredible numbers.
which rapidly sporulate in that warm creep area and turn the microenvironment into this overwhelmingly contaminated zone. So this completely shifts the focus of control. It's not about treating the sow, it's about managing the piglet, and most importantly, about rigorous hygiene in that farrowing environment.
Okay, that makes sense. So if it's environment to piglet, what specific factors on a farm really increase the risk? What sets the stage for Isospora suis to really take hold?
Yeah.
Let's start with the basics. Hygiene and management.
Yeah, inadequate sanitation between farrowing groups is a huge risk factor, especially in continuous flow operations.
Why continuous flow specifically?
Because in those systems, rooms often aren't completely emptied, cleaned, and disinfected between batches, so you're constantly leaving behind a reservoir of infectious oocysts from the previous group, creating this persistent background level of contamination.
Got it. What about housing design? Does that play a role?
It does. Things like solid concrete floors or maybe using straw bedding tend to be higher risk than, say, fully perforated or slatted floors.
Why is that? Moisture.
Exactly. They retain more moisture and fickle material, which, as we know, is just perfect for oocyst survival and sporulation.
And piglet management itself, any risks there?
Yes, particularly cross-fostering. While it's a common management tool, moving piglets between litters can unfortunately act as a really significant vector, inadvertently spreading the infection by moving either infected piglets or just oocysts carried on them to new, clean environments or litters.
Right, okay. Let's connect this back to the damage. How does the parasite actually cause the disease? We talked about the life cycle destroying cells.
That's essentially it. The pathogenesis, the way the disease develops, is a direct result of that intracellular life cycle. Those repeated cycles of invasion, multiplication inside the enterocyte, and then bursting out lysis cause extensive destruction of the intestinal lining. And this damage is most severe in the jejunum and ileum, those critical middle and lower parts of the small intestine responsible for absorbing most nutrients.
So if we were to look at the gut tissue under a microscope, what would we see? What are the key lesions?
The most striking feature is something called villus atrophy.
Villus atrophy. Sounds bad.
It is. Picture the lining of a healthy piglet's intestine like maybe a plush, velvety carpet. It's covered in millions of tiny finger-like projections called villi. These dramatically increase the surface area for soaking up nutrients from milk. With coccidiosis, the destruction of those enterocytes covering the villi causes them to become much shorter, blunted, sometimes even fused together. It's like that plush carpet gets severely worn down, flattened, or even ripped up in places.
Which drastically reduces the surface area for absorption.
Precisely. The gut tries to compensate by increasing cell division down in the base areas, the crypts. We call this crypt hyperplasia. But these new cells are often immature. They don't have the full set of digestive enzymes or transport proteins needed for efficient absorption.
So what are the immediate consequences of this gut damage for the piglet?
Well, the most obvious one is malabsorptive diarrhea. That damaged, flattened, immature lining simply can't digest or absorb the nutrients from the milk properly, especially things like fats and sugars. These unabsorbed nutrients then hang around in the gut and create an osmotic imbalance, basically drawing water into the intestine. That leads to that profuse, watery, pasty diarrhea we talked about.
And that directly causes the poor weight gain and stunting.
Directly. But it's not just about malabsorption. That widespread destruction of the gut lining also compromises what we call gut integrity. The barrier function is weakened, meaning the intestine becomes more permeable or leaky. This makes the piglets incredibly vulnerable to secondary bacterial infections getting through that damaged wall.
Okay. And this leads to another point, doesn't it? That Isospora doesn't always act alone. It can actually make other gut problems worse.
That's absolutely right. It can create what we call synergistic pathologies. Think of the Isospora infection as the primary insult. It damages the gut so severely that it completely disrupts the normal microbial ecosystem, creates an imbalance or dysbiosis.
And that opens the door
for other opportunistic bacteria, which might normally be present in low numbers, to suddenly overgrow and cause disease. A really well-documented example is with Clostridium perfringens type A, often called CPA. We know that a preceding Isus infection can significantly worsen a subsequent CPA infection, leading to much more severe necrotic enteritis tissue death in the gut and, unfortunately, increased mortality.
Wow. So treating the coccidiosis could actually help prevent these secondary issues.
Exactly. In fact, studies have shown that effective anticoccidial treatment using toltrazuril can actually prevent the severe outcome with CPA. It really highlights Isus acting almost as a gateway pathogen, weakening the gut's defenses and paving the way for other, sometimes deadlier infections.
Okay, we've gone deep into the science, but let's bring it back to the farm level. For a farmer or a vet walking into a farrowing house, what does this actually look like? What are those telltale signs that Isospora suis might be the culprit, especially when other things can cause similar issues?
Yeah, absolutely. It's often not immediately obvious. It can be a bit of a master of disguise. But the clinical picture does have some characteristic features, especially when you consider the context. First, the age of onset. It's typically between 7 and 15 days of age. That's a really crucial first filter. If you see diarrhea in piglets that are, say, less than 5 days old, you can pretty much rule out Isus because of that 5 to 6 day pre-patent period we discussed earlier. It just hasn't had time to develop yet.
Right, that's key timing clue. What about the diarrhea itself?
It's typically non-hemorrhagic, so no blood. It's often described as pasty or watery, and the color is quite characteristic, usually yellow, white, or maybe grayish. And frequently, it's quite foul-smelling.
And the piglet's general condition?
Affected piglets often look dehydrated. They become lethargic, maybe develop a rough or hairy-looking coat, and crucially, they fail to gain weight like their litter mates. You'll often see significant size variation within a litter by the time they reach weaning. But again, as we mentioned, actual mortality from uncomplicated coccidiosis is usually low. It's the poor doing, the lack of thriving, that's the main issue.
And that other key clue, we talked about the lack of response to antibiotics, that really helps narrow it down from bacterial causes, doesn't it?
It's a huge diagnostic pointer. If a farmer has been treating a litter for diarrhea with broad-spectrum antibiotics and seeing absolutely no improvement, Isospora suis should jump right to the top of the suspect list.
Okay, so you suspect it based on age, signs, and maybe lack of antibiotic response. How do you actually confirm it? What are the diagnostic steps?
Well, the most common approach for diagnosis in live animals antemortem diagnosis is fecal analysis, usually using fecal flotation techniques to look for the oocysts under a microscope.
Sounds straightforward.
It sounds straightforward, but there's a really significant limitation. Remember how diarrhea often starts before the piglet starts shedding oocysts, maybe 3 or 4 days before?
Ah, right.
So a piglet that's acutely diarrheic right now might actually test negative for oocysts, a false negative, because it hasn't started shedding them yet.
So how do you get around that timing issue?
Well, that's why often epidemiological sampling is recommended. Instead of just sampling one piglet, you might collect pooled fecal samples from several piglets in the litter, or maybe do serial sampling over a few days. Interestingly, sampling piglets that are just starting to recover from the diarrhea can actually be more fruitful, because that's typically when oocyst shedding peaks.
Okay. But what about definitive proof? The gold standard.
For definitive confirmation, post-mortem diagnosis examining piglets that have died or been euthanized is really the gold standard.
And what would you look for in a post-mortem?
On gross examination, just looking at the intestines, the lesions can sometimes be subtle. You might see mild to severe inflammation enteritis, mainly in the jejunum and ileum. The intestinal walls might look a bit flaccid, thin, maybe filled with watery or creamy yellow fluid. In more severe cases, you might see a yellowish, sort of fibrinous membrane covering the gut lining.
Can you get a quicker answer post-mortem?
Yes, you can often get a rapid presumptive diagnosis by making impression smears directly from the mucosal lining of the jejunum or ileum and looking under the microscope. You can often see the endogenous parasite stages, the meronts and gemonts right there in the cells.
But for absolute certainty.
For absolute certainty, it's histopathology, sending fixed sections of the affected intestine to a lab. That's where pathologists can see that characteristic severe, diffuse villus atrophy, that flattened carpet effect we talked about, along with the compensatory crypt hyperplasia. And most importantly, they can definitively identify the intracellular Isus stages within the damaged tissue.
So it sounds like putting the puzzle together requires considering the age, the signs, the lack of antibiotic response, and then confirming with fecal tests, or ideally post-mortem. When a vet walks into that farrowing house and sees diarrhea, it really is like a diagnostic puzzle, isn't it? How do they differentiate ISUs from those other common causes? Are there any classic red herrings?
Absolutely. Differentiating is key. And yes, there are definitely potential lookalikes. As we said, age is a huge first filter. Diarrhea under 5 days, probably not ISUs. That points more towards things like
Like E. coli?
exactly. Enterotoxigenic E. coli or colabacillosis that typically hits piglets under 5 days old, causes profuse watery diarrhea, often yellowish or clear, can cause high mortality if not treated, but crucially, it does usually respond well to appropriate antibiotics.
Okay. What else?
Then you've got Clostridium perfringens type C. That usually hits very young piglets too, often under 7 days. The diarrhea is often more severe, watery to reddish-brown, sometimes bloody with necrotic debris. Mortality is typically very high, and treatment response is often poor because it progresses so rapidly.
Right, sounds nasty. Anything else common?
Rotavirus is another big one. That can affect piglets over a slightly wider age range, say 5 to 21 days, overlapping with ISUS. It causes watery yellow to gray diarrhea. Mortality is usually low to moderate, but like ISUS, it won't respond to antibiotics because it's a virus. So the lack of antibiotic response isn't unique to coccidiosis.
So you really need to weigh up the age, the specific type of diarrhea, the mortality pattern, and that antibiotic response clue alongside diagnostic tests to really pinpoint the cause.
Precisely. It's about looking at the whole picture.
Okay, given how tough this parasite is, how resilient those oocysts are, and how quickly it cycles in that farrowing environment, how do we actually fight back effectively? What are the cornerstone strategies for treatment and prevention?
Well, the central tool in our treatment arsenal is undoubtedly toltrazuril.
Toltrazuril. What makes it so effective?
It's a really potent coccidiocidal agent. That means it actively kills the parasite rather than just slowing it down. And crucially, it targets all the intracellular developmental stages of ISUS. So it effectively shuts down that cycle of replication and destruction inside the piglet's gut cells.
And you mentioned earlier the timing of giving this drug is absolutely critical. Just treating piglets after they already have diarrhea isn't really the best approach, right? Because the damage is already done.
That's a critical point. Yes, waiting until you see obvious diarrhea means a lot of the intestinal damage and therefore the production loss from poor growth has already occurred. Treatment at that stage might help resolve the diarrhea, but it won't fully prevent the economic impact.
So if treating after signs appears too late for optimal results, what's the standard proactive approach?
The standard and most effective approach is called metaphylaxis.
Metaphylax?
Yeah, it basically means treating all the piglets in a litter, or all piglets within a certain age group on the farm at a specific time point, regardless of whether they're showing signs yet. For ISUS, this typically means treating all piglets between 3 and 5 days of age.
Why that specific window? 3 to 5 days?
It's strategically timed. We know piglets are likely exposed and infected very early, often within the first day or two. Treatment at 3 to 5 days interrupts the parasite's development after infection has occurred, but before it has completed enough replication cycles to cause significant intestinal pathology and clinical signs. It nips it in the bud, essentially.
And how is it given?
The standard dose is a single oral administration, usually 20 milligrams per kilogram of body weight. There are also some convenient injectable formulations available now that combine toltrazuril with iron supplementation, which piglets also need early in life.
Okay, so timed medication is key for the piglets. But what about the environment? Given how incredibly resilient those oocysts are, environmental control must be a huge piece of the puzzle. But it sounds really challenging.
It is challenging. It's probably the toughest part of controlling coccidiosis, honestly, because, as we discussed, most standard farm disinfectants, your quats, phenols, aldehydes, they're largely ineffective against these sporulated oocysts that just bounce right off that tough wall.
So disinfectant alone won't cut it. What does work?
The absolute foundation of environmental control must be meticulous physical cleaning first. You have to physically remove all the fecal matter and organic debris.
Why is removing the debris so important?
Because that organic matter actually protects the oocysts. It shields them from heat, drying, and even from any disinfectants you might apply later. So step 1 is always thorough cleaning, high-pressure washing, ideally with hot water, say above 70 degrees Celsius, or even steam cleaning if possible. That physical removal and heat will kill a lot of oocysts.
And only after that cleaning?
Only after the surfaces are physically cleaned should you apply a chemical disinfectant. And critically, you need to use a product that has proven oocytal activity.
Like what, for example?
Products based on cresol or certain ammonia-releasing compounds have shown good efficacy against Isospora oocysts. but they often require specific application procedures and careful handling due to safety considerations. They're not your everyday disinfectants.
Okay, so cleaning is paramount, followed by specific oocidal disinfectants. What about management practices? Are there things farmers can do in terms of how they run the farrowing house to help break that transmission cycle?
Absolutely. Probably the single most effective management strategy is implementing strict all-in, all-out AIAO protocols for farrowing rooms or barns.
All in, all out, meaning?
Meaning you completely empty the room of all animals between batches of sows and piglets. Then you have the time and access to do that thorough cleaning and disinfection we just talked about without any animals present. This completely breaks the cycle of environmental contamination between groups.
That makes sense. Anything else on the management side?
Yes, even with AIAO, good daily hygiene practices within the farrowing pen help a lot. Regularly removing feces, especially from the creep area, reduces the immediate oocyst load that piglets are exposed to day to day. And trying to maintain a dry environment, particularly in those warm creep areas, is also beneficial. Because remember, moisture is essential for sporulation. Anything to keep things drier helps slow the parasite down.
And biosecurity. Does that play a role?
It does. Things like robust pest control are important. Flies, cockroaches, even rodents can potentially physically transport oocysts from contaminated areas to clean ones. So keeping them under control is part of a comprehensive plan.
So it really sounds like there's no single silver bullet here. You can't just rely on the medication or just on cleaning.
Precisely. That's why it's absolutely vital to stress the importance of integrated control programs. Sustainable, long-term control of porcine coccidiosis simply cannot be achieved with just one intervention. It requires a strategic combination of everything we've discussed. Good management practices like AIAO, rigorous environmental cleaning and decontamination with effective products, and precisely timed metaphylactic medication with toltrazuril.
So if you only do one, say just the treatment, it's likely to fail.
In the long run, yes. If you rely solely on treating the piglets but don't address the massive environmental contamination, each new litter that comes into that farrowing room will face incredibly high infectious pressure right from day one. The treatment might help them, but the problem will persist and likely worsen over time. You really have to think of it as a race against the parasite's life cycle. You need to be proactive, targeting both the parasite developing inside the host and those super resilient oocysts waiting in the environment.
Okay, that's a very clear picture of the integrated approach needed.
Yeah.
Let's talk about the bottom line then. What does this all mean financially? How significant is the actual economic impact of Isospora suis on the swine industry?
It's really substantial, but as we've said, it's often underestimated because the main driver isn't usually high mortality rates, it's the morbidity, the sickness, and poor performance. Those reduced growth rates and the poor feed conversion efficiency that result from the gut damage and malabsorption are direct economic losses.
Can you quantify that, like the weight difference?
Yeah, it's quite common for piglets recovering from a significant coccidiosis challenge to have significantly lower weaning weights compared to unaffected piglets. We're often talking reductions of maybe 0.3 to 1 kilogram per piglet.
And does that difference just disappear later on? Do they catch up?
Often, no. That initial deficit frequently isn't fully compensated for later in the nursery or finishing phases. This means it takes longer for them to reach market weight, which increases overall feed costs, facility costs, and labor costs per pig.
And what about those subclinical infections you mentioned? The ones without obvious diarrhea?
They're a real hidden drain. Even without scouring, the parasite can still be causing enough gut damage to impair nutrient absorption and subtly reduce growth rate and feed efficiency, cutting into profitability without being obvious.
Plus the cost of secondary infections.
Exactly. The role of coccidiosis in predisposing piglets to more severe secondary bacterial enteritis adds another layer of cost through increased treatment expenses for those secondary infections and potentially higher mortality in those complicated cases. So the total economic hit is multifaceted.
Looking ahead then, what's on the horizon for research and control in this area? Where are scientists focusing their efforts? What are the big unanswered questions?
Well, there are several key areas for sure. I think developing an effective vaccine against ISUS remains a major long-term goal. It's challenging for protozoan parasites like this, but it would be a game changer if achieved. We definitely need ongoing monitoring for potential drug resistance to toltrazuril. While it's highly effective now, we've seen resistance develop to anticoccidial drugs in the poultry industry over time, so it's crucial to be vigilant in pigs too.
And that question about stages outside the gut.
Yes, further research to definitively identify and characterize any potential gastrointestinal stages of ISUS is important. If they exist, understanding them could give us completely new insights into the parasite's epidemiology, how immunity develops, and maybe even new control targets.
Any developments needed in diagnostics?
Absolutely. Developing rapid, sensitive, and cost-effective diagnostic tools that could potentially be used right there on the farm would be incredibly valuable. Faster, easier diagnosis would allow for much more targeted and efficient application of control measures rather than just blanket treatments.
What an incredible journey we've been on today. We've really gone deep, haven't we? From understanding this tiny, almost invisible parasite, Isospora suis, to seeing its profound impact on global agriculture, and just exploring the fascinating and sometimes quite alarming ways it interacts with its host, the piglet, and the very environment we create for them on modern farms.
It really is a constant battle against a very resilient and cleverly adapted pathogen. But the good news is our understanding of its intricate life cycle, how it spreads, and where its vulnerabilities lie, is constantly improving. And that knowledge allows us to develop and refine these strategic, integrated control programs that really can make a significant difference for producers trying to manage it.
Absolutely. It leaves you thinking, doesn't it? Knowing this intricate dance between Isospora suis, the piglet, and the modern farm environment, it makes you wonder, what other surprising unintended consequences might we be creating in other areas of intensive animal production? And how might a similar deep dive into those hidden connections reveal the next big challenge we need to face, or perhaps the next innovative solution, something to mull over?